On this episode, we'll talk about knee replacements, hip replacements. We'll also talk about hair loss in men, and we'll talk about counting carbs. Hello everyone, I'm Dr. Alvarez with Endobariatric.com, and welcome to episode 140 of the AskDrA show. Thank you so much for being here. Thank you so much for sending the questions. Hashtag AskDrA on social media for you to send us your questions, or through my Instagram account. By the way, right now, we just posted a giveaway on my Instagram account. We're going to be giving five original blender bottles from EndoFit. You got to check it out, by the way. All right. Okay, so let's jump into the questions.
As a total knee replacement patient, are there any concerns related to infection?
Yes. So anybody that gets a hip replacement, knee replacement, a major replacement like that, you got to be careful, because any invasion to your body, you are more susceptible to infection. So having teeth dental work done, even the sleeve done, or anything like this, you got to tell your doctor, because you do need prophylactic antibiotics. What does prophylactic mean? It means something to prevent down the road. You want to prevent bacteria. You want to prevent an infection down the road. Just to put your mind at ease, absolutely, at least in our practice, absolutely everybody gets antibiotics prior to the procedure, just to be on the safe side.
Can male patients also lose their hair after the surgery?
Can men have hair loss? The answer is yes, obviously. Well, not in my case, I don't have a sleeve, but yes, the answer is yes. If you do get a sleeve, you're not immune to getting or having some hair loss. But let me tell you this, that precise hair that falls off because of your body changing, because of your body going under stress, it regrows, all right? Mine doesn't.
When looking at carbs, do you count total carbs, dietary carbs, or sugars?
Very good question, and a lot of people are like counting carbs. There are a lot of people are looking into a low carb diet, and for that you got to count your carbs. The question is, do you count your total carbs a day minus your dietary or fiber sugars, minus your alcohol sugars, leaves you with your net carbs? Do you count your total carbs or your net carbs? The answer is you count your net carbs. If you're counting your net carbs and you're crushing it, you'll get great results. And it doesn't mean I'm really promoting this diet. I know this form of dieting helps some people, it goes along with their lifestyle. You gotta do what works best for you, but it works really good on sleeve patients. Back to the question, count your net carbs. All right, so that is it for episode 140 of the AskDrA show. Send us your questions, hashtag AskDrA, and through my Instagram account. Don't forget, you want to win that blender bottle. We're going to be giving 5 out for this week, so check it out. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care. God bless.